Brilliant ambition.
I know at times they sound depressing, but really not all that bad. Dr. Michael Witnowski, who's a plastic surgeon and reconstructive surgeon, is with us. Talk a little bit about how science and medicine is trying to undo some of those effects. Why do people get bald, anyway?
Well, there are obvious causes of baldness from some trauma and burns and so forth. There are some skin causes, dermatologic causes, which are medically treatable, but the most common cause is genetic. It's inherited. It runs in some family lines and doesn't run in others.
So there's not really too much you can do about it?
Not really.
How about I know a lot of men go through these hair transplants. That was very in vogue for a while, and you don't hear about it all that much anymore. Is it still being done as much as it was?
Still being done. There are several surgical approaches to baldness. The easiest thing for one to do is to wear a hairpiece, obviously, but there are several surgical things that can be done. There are grafts that can be taken from hair-bearing scalp, which does not bald, which is usually in the back of the scalp, and they can be moved to the non-hair-bearing areas to grow very much like grass sod grows when it's placed in a new location. There are a couple of new procedures which are being done as of the last few years, where a tongue of tissue is taken from one's temple and left attached to its own blood vessels and brought around to the front of the scalp to replace the missing tissue. And then there's an operation called a scalp reduction procedure, which is one whereby the bald spot is literally excised, cut out, removed in a multi-stage procedure to make that area smaller and ultimately to eliminate it.
That sounds terribly painful.
Pain is minimal with any of these procedures. The thing that people have to realize is that it's not perfection that they get, it's a significant improvement, and men have to be patient because it's not all done in one sitting and in one stage.
What about women now? Can women go bald?
Very rarely. Women more commonly become bald because of medications they're taking or because of skin diseases, although again, as they age, their hair will thin.
And is there anything you can do? Can they do the same procedures for women?
If necessary, sure.
They can?
Sure. And women more commonly end up having these procedures because of trauma, because of injuries, burns and so forth. But they can be done on women also.
Now, how important is it? I suppose you could, because you see people all the time, and
sure.
You see the husbands who come in who are bald, and their wives say, well, he just isn't the same guy as he was. Is it psychologically very important for some people to have hair?
It's, you know, that's a hard question to answer because it's such an individual, it's a subjective perception. I mean, one can look in the mirror and be bald and think they look fabulous, and the next person is very unhappy. There are people who are very psychologically devastated by their baldness, and those are the people who ultimately seek out some sort of a treatment, whether it's a piece or a surgical treatment.
Well, we're going to take a look at what happens to your skin, too, when you get older, when we get back, so stick with us. Well, there are, again, we see what is happening to our skin and the muscles and all that has an effect on our face, doesn't it?
Most certainly.
And all over. Why is it? What happens underneath, and what happens to the cells to make our skin sag and stretch and not look as good as it used to be?
It's sort of an inside and an outside process. You know, on the inside you have fat and muscle tissue, and as you age, that muscle tissue, instead of being like a nice firm steak, becomes kind of stringy and soft, and as it loses its tone and strength, the fat over it kind of sinks into the softness, and then the skin sinks into that. In addition, the outside influences of environment and sun and so forth will dry your skin out, literally, and that on top of the inside contour defects will cause you to kind of sag and look old and tired.
Well, now, we talked about with baldness how much of it is genetic. How much of it is genetic as far as how much your face will sag?
It's very difficult to say what percentage is genetic. It's mostly genetic. If your mother looked 70 when she was 50, then you may indeed follow that pattern. There's some things that you can do, perhaps, to not follow that pattern exactly. But,
for example?
Avoidance of excess alcohol and smoking. It's a known fact that those factors to excess will cause premature aging. Proper moisturizers, proper skin care, live in the proper environment. You know, we know that people who live in dry climates tend to age a little bit prematurely to people such as us in this city who don't live in that sort of a sunny, dry climate all the time. And avoidance of excess sunlight, avoidance of basking and bathing day after day after day.
if you like to get out of the sun and you put on a real heavy sunblock, does that really do what it intends to do? Does that really help?
Certainly, sunblocks are, there's a misconception. People think sunblock, because you put this cream on, it blocks the rays. But what it does is it blocks the rays that burn your skin and are cancer-causing rays, skin cancer-causing rays. They have a different wavelength, basically. And the sun tanning rays are different. And what the block does is block out the bad rays and let in the good rays. So you can still tan safely and not have such a bad detrimental effect on your skin.
All right. You see these ads, oil of Olay, all these moisturizers, and they promise this terrific skin. Now, I'm going to put you on the spot. Does something like oil of Olay do any good?
Okay. I think you can put all these products in a basket and call them moisturizers. And I think it's important for frequent daily moisturizing for men and women. And as long as you keep that skin moist, however you do it, whatever product you use, then that will minimize the cracking and aging process to a degree.
So it does.
There's no false promises or no magic.
Yeah,
But it helps.
So moisturizers actually...
Oh, for sure. There's no question about it.
What can you do then after, let's say the damage is already done? You, as a kid, when in your 20s, you love to go out there on the beach at Lake Erie, and you love to get brown, and all of a sudden you're turning 30 or 40, and here are the effects starting. So what can you do to reverse the effects? Anything at all?
Well, there's lots of surgical procedures that can be done, and most so-called cosmetic surgery of the aging face approaches the face in units, depending on which part of the face is more aged and which part bothers that individual.
What's the most common face surgery that is done?
Most common face surgery is a rhinoplasty, nose job, but that's done more for appearance as opposed to aging. Most common surgery for aging has to do with so-called blepharoplasty or eyelid tuck or rhytidectomy or facelift. Those are the two most common surgeries that are done.
So the eyelid tuck, what do they do when they do that?
Basically, little incisions are made under the eyelashes on the lower eyelid and in a skin fold on the upper eyelid, and excess skin, fat, and muscle are removed to give you a more youthful appearance.
And this is where they take it out?
Exactly.
Does that last for quite a while?
Once you've had some sort of cosmetic surgery on the aging face, you're always ahead of the game. But the aging process is ongoing. It's a slow process, but it does continue. And those factors we talk about will accelerate it. If you've had a facelift or your eyelids fixed and you go out and sunburn yourself over and over, then you will accelerate what happens. But you don't wake up one morning and everything falls. It's a very slow, progressive effect.
It's a tough decision to make, too, to have facial surgery, I know.
I think if you have your surgery done by a properly trained, board-certified plastic surgeon, then that's perfectly safe for you. He certainly will go over all the problems and complications and so forth, but cosmetic surgery is being done in great numbers in the United States and being done quite safely. Everybody hears horror stories and so forth, but you know, the majority of patients, the very large majority, do very well with cosmetic operations.
Well, Dr. Witnowski, I know our audience wants to ask you some questions about the aging process and surgery and all that, so we're going to have a chance to do that when we get back, so stick with us. Well, welcome back. Before we get back to talking about aging and skin with Dr. Witnowski, I want to introduce you to Star Williman. What a terrific name.
Thank you.
You brought this wonderful group down from...
Yes, I did. Warren, Ohio.
Warren, Ohio.
YWCA.
Yes, and if you want to bring your group out, you can write to us for reservations at AM Cleveland at 1403 East 6th Street, and the zip code is 44114, or you can call 344-3378 and make your reservations by phone. And if you've got a group of 40 to 45, we'll even send out a terrific bus to come and get you. You had a question for Dr. Witnowski.
Yes, I wanted to know if women who have freckles age as quickly as women who don't.
Women who have freckles are usually a little bit more lightly pigmented than women who don't. And the lighter pigment you have in your skin, usually the thinner your skin is, and usually the less rapidly you progress. But all those other factors enter into the picture, especially the sun.
Yes.
If you're planning on having some of these things done, is there a certain age that's better than, I mean, should you?
It's you can't really say a certain age. Everybody's different. There are people, we all can look in the room and know that there are people who are 50 who look much younger than 50 and people who are 50 who look much older. It's pretty much an individual problem. In other words, you have to sort of decide what is bothering you about your appearance, whether it's your eyelids or your jaws or whatever, and then approach a plastic surgeon and let him evaluate it, and then he can tell you whether it's really the cost benefit, whether you really ought to have the procedure at this point in time or not. Average age of eyelid type surgery are people in their mid-30s up, and facelift surgery patients are mid-40s up. But that's average. There are people who are younger that have those things done, and people who don't until they're in their 60s. It varies with individuals.
Would you ever think about doing this?
Oh, sure.
Have you thought about it?
Definitely, yes.
That's great.
Yes, if
And
my
what-
husband would allow me. Really?
Do you have any fears about it?
Not really, no. No, but I don't want to do it until I'm really need it.
When it is, it's got to be tough to decide when you need it, though, because isn't it true that once you've started, that's what I've heard. Now, that's probably not right. You set me straight. Once you've started, after 5 or 6 years, you got to keep it going.
No, not necessarily. Like I said, you're ahead of the game. Certainly, a plastic surgeon would not do a facelift or an eyelid operation on someone who didn't need it because they wouldn't get a satisfactory result from it, and it wouldn't be of benefit to them in the long run. So it's not necessarily once you start it, you're into it and addicted to it. It's just something that you have done as you need to have it done. Many patients have these procedures one time and one time only.
And they're lucky because their genes say that their faces are not going to age anymore,
Yeah.
or
Plus
whatever.
you have to take care of yourself afterwards,
Which is the
which
things
is
you
discussed
talked
with these
about.
patients
Yeah.
too.
I'd like to know about age spots, what you can do about them when they start.
Okay, there's again nothing magic to get rid of age spots. There are some over-the-counter items that you can buy, so-called bleaching creams and so forth, which may improve the appearance of age spots. Makeup is probably the best thing. If you have a large amount of age spots, you can have a surgical procedure called a chemical peel, which will peel sort of the outer layer of your skin in a controlled manner and improve their appearance. But makeup probably is the easiest.
Okay, before the show, we were wondering about what the costs of these procedures run in this area
Okay.
of the country.
Cosmetic surgery procedures, again, vary, depending on the procedures and depending on how many procedures you have. Procedures may cost anywhere from $1,000 to $3,000 or $4,000, depending on how much you have to have done and how extensive they are. And that's discussed with you when you see your plastic surgeon in detail.
How do you choose a good one?
A good what?
Good plastic surgeon.
Pardon me, I'm sorry. Okay. It's important that you're comfortable with your plastic surgeon, that you like him and that he likes you and that you have a good rapport, because you're entering into a very intimate relationship with someone of this nature when you're having a cosmetic procedure. Your plastic surgeon should be properly trained. He should be board certified in plastic and reconstructive surgery. And how do you find one? You can maybe ask your family doctor, ask a happy patient. You can find out from the Academy of Medicine in Cleveland here, or the National Plastic Surgery Society has a phone number which you can get from the Academy and call, and they'll give you the name of a properly trained plastic surgeon. Don't hesitate to make sure your doctor is properly trained, and don't hesitate to ask him.
In the film clip, you talked about the shrinking process and being 5'1". The thought of being under 5'2" or under 5 foot in a few years is frightening. Is there anything that you can do to retard the shrinking of your body?
Not to my knowledge.
One of the things that they are talking about are these gravity boots that they say if you sit upside down for some time that it's going to help undo that. But I
really don't know. That may be a Madison Avenue ploy. I really have no idea.
Okay. You had a question also, I believe.
I wanted to ask, when you get a certain age and you get that little fuzz all over your face, those little hairs, how do you get rid of them? No?
You should trim them and cover them with makeup.
That's the only way?
Right.
Not a good idea to have the, what do they call it?
The peel, the chemical peel?
Or electrolysis?
Well, you can have electrolysis, but electrolysis is a procedure which takes a long, long time, and there are hundreds and hundreds and hundreds of little hairs. Most of them are blonde and fine, and you can trim them, the longer ones, and then camouflage the rest with makeup.
What do you do when you want to go to the south and you have loss of pigment in your skin?
Okay. I'm sure you've all heard of sunblock. Sunblock is an item that you can buy over the counter, and it has this number SPF, which means sun protection factor. And those numbers vary anywhere from 2 to 15, which is like a total block. When you first go in a sun-exposed area, you should wear high number sunblock and then progressively lower it as your tanning process progresses. But you should wear a block to get rid of those burning rays.
Dr. Witnowski, I want to thank you so much for talking about skin and aging and all those things. We will, of course, continue our discussion of aging tomorrow. And coming up next on AM Cleveland, we will talk about a disease that has gotten